Lymphoma, hidden in plain sight. These are the faces of lymphoma. Lymphoma doesn't care how old you are, nor the color of your skin. Lymphoma doesn't go out of its way to be seen either. Lymphoma would prefer you don't see it right away. That way it has time to grow and spread. Lymphoma is a type of cancer involving cells of the immune system called lymphocytes. Just as cancer represents many different diseases, lymphoma represents many different cancers of lymphocytes. About 35 different subtypes, in fact. What makes lymphoma especially dangerous is that being that your body is covered in a virtual web-like lymphatic system, once cancer has arrived in that web, it is like driving on an efficient freeway system to anywhere on your body which it wants to go. There are two main types of lymphoma: Hodgkin lymphoma, which is the less common form of the disease and involves the Reed-Sternberg cells, and non-Hodgkin lymphoma, which does not involve the Reed-Sternberg cells. The more common non-Hodgkin lymphoma has more than 61 different subtypes. Patients with lymphoma often start their disease progression with a series of common symptoms: swelling of the lymph nodes, fever, unexplained weight loss, sweating including night sweats, chills, itching, and a general loss of energy and increase in fatigue. It is important to note that so many of these symptoms are generalized, non-specific symptoms, so they are not unique to lymphoma, but they do often present in patients with this potentially fatal disease. At the present time, the cause for lymphoma is unknown. However, it has been noted that certain individuals with an autoimmune disease, organ transplant recipients, those with a family history of lymphoma, seem to be particularly susceptible to lymphoma. A skillful pathologist is needed to properly diagnose lymphoma. The pathologist will use tools available such as CT and PET scans, blood work, biopsies, and immunochemistry. The challenge which exists is that there's not a single definitive test which exists to diagnose lymphoma, so an expert physician is paramount. Non-Hodgkin lymphoma, once diagnosed, is staged based upon the spread of the disease and disease progression. The number of lymph nodes, as well as the area of the body that has been affected, determines which stage the patient is in. There are many treatment options available for lymphoma. The type of treatment used is determined by the physician in agreement with the patient and is determined by the stage of the disease which the patient is currently in. Early detection and early treatment are important, and such awareness is key. The more we know, the better chance for patients diagnosed with lymphoma to live long, happy lives.